come true in Malibu.
Time for Wellness Wednesday, brought to you by Elevate Women's Health Center in Port Perry and chiropractor Shawna Dingman, Port Perry's only chiropractic and functional healthcare center focused on women, children, and babies. Don't let health concerns hold you back. Dr. Shawna Dingman, chiropractor and functional healthcare practitioner since 2000. And Shawna is on the line with Scott Campsall right now. Good morning, folks.
Good morning.
Okay, everybody, hold on. I'm just going to do a big stretch here. Hang on. Oh, okay. And that big sound you heard was my back. So, and I'm sure there are a few people out there. Shawna, we kind of talked about this during the pandemic at one point. Is there a true connection in the number of people walking in your door with lower back issues and what is going on and anxieties with the pandemic?
Well, I think so. I mean, I don't have any data or studies to give you, but I can tell you that I've seen a lot more women with low back pain in the last 4 months than in any 4-month period I've probably had in my entire 20-year career so far. And I've seen a lot more kids with back pain. And that's kind of, I think that's one of the really important considerations here. The studies show that over 70% of adults are going to have some episode of back pain at some point in time in their lives. But what's really cool is that spine research is showing now that if kids have back pain and it goes uncorrected, because, as parents, we tend to sort of brush things off sometimes with our kids. But if it goes uncorrected, we know now that they are much more likely to become chronic back pain sufferers as adults. And when you talk about anxiety and stress, I mean, anxiety and stress can trigger anything that's going on in the body. So if you are going to be prone to something like that, stress or anxiety is going to trigger something that might not have occurred, but now it will.
Now, do you say that, this occurring in youth could mean a lifelong problem? Is that because they compensate and then everything's out of alignment and over time you're going to develop some actual physical issues, even more physical issues?
Well, what we're really seeing is, and I've mentioned this before in our Wellness Wednesday segments, we're really seeing a change in this generation of kids in the structure of their spines. And I'm just going to lob it out there. I think that it's because of they have so much more device use, and it's at the expense of what used to be normal kids' play. So it is actually changing the structure of their spine where they should have a straight spine. Sometimes now there's curves, and where there should be curves, those curves are straightening out, for example. So that's a big consideration, is that at a young age, the structure is now different and they're going to grow with that. But on top of that, there's a whole neuromuscular patterning. Chronic pain is actually it is an event that occurs inside the brain. So it's a pattern that develops. When you have some kind of physical injury that causes pain or some kind of trigger that causes pain, there are chemicals that are released from the brain and in other parts of the body. And then that can actually become a pattern that even when the injury is healed, if that pattern isn't broken, then chronic pain becomes a situation where it's a neuromuscular patterning that needs to be broken. And so that's the issue. If they're getting that as kids, and then that becomes a pattern that their brain will go to, that's where the problem occurs in chronic pain as adults.
Is that something maybe we are experiencing with fibromyalgia, something we really don't truly understand?
I'm not sure that I should comment on that, Dan. I don't know what the research is showing on that, and I don't want to just put it out there.
Right.
What I can say is that fibromyalgia, if you have it, it is absolutely real. It's a mystery. It's different in everybody who has it, and it's there though, and it needs to be addressed. And then the question is, what is the best way to address it? But definitely there is a chronic pain cycle that's going on.
Okay, well, we know that you can address lower back pain, so
sure.
Let's get back to that, so to speak. And what are there simple things we could be doing?
There are. Why don't we just begin by talking about some strategies? If you're in an episode of low back pain right now, let's just talk about a few strategies to help get you healed from it. And then maybe if we have time, we can talk about some things to help prevent going back into it. So about 5 or 6 weeks ago, I had a water skiing injury, and I had the worst bout of acute low back pain I have ever had in my life. It was like I've never had pain like this. And so I really sort of tracked what I did through that week after to get me better, because I injured myself on the Sunday, and by Wednesday, I could hardly move. Like, every movement was painful. And if you are a low back pain sufferer, you know exactly what I'm talking about. Just shifting from position to position, getting in and out of bed, getting up and down. Everything is just gut-wrenchingly painful. So by the time Saturday came, I was feeling so much better that I was actually able to do my first karate class that week. And it was painful. I don't know if you remember that, Scott, but it was hard to move, but it was definitely, I mean, I wouldn't have shown up if I couldn't have participated in the class safely. And then by Sunday, it was like it never happened. So some of the strategies for getting out of that kind of pain as quickly as possible, first thing, and it's kind of counterintuitive, but you want to keep moving as much as possible. There are always positions that you can find that are less painful or are even pain-free, and spending a little bit of time trying to get your body into that position. And usually it's an upright, neutral posture where your pelvis isn't sort of flexed. You're not slumping those shoulders forward. It's, as your grandma used to say, stand up straight. Nice, straight, tall head, shoulders back. Pelvis in neutral. When you can get your body into that position, that takes so much pressure off of all the muscles that are flaring in the low back, pressure off the discs. It is your body's go-to neutral position. So as much as you can get yourself into that position and move without sort of moving from that position, do you know what I mean? Like, if you wanted to brush your teeth, for example, you would try and bend forward, hinge forward at the hips rather than bending forward. So it's keeping your spine in as neutral a position while you try and go about as many normal movements in your day as possible, and resisting that urge to lie down on a couch or lie down on a bed where there's just not enough support.
Well, go ahead, Scott. Before you jump in, though, I just want to ask, because when I had a massage a little while ago, they pointed this out, and they say it tends to be a guy thing. But because you're exercising, doing weights and things like that, they just, and the reminder is always, you're not wearing your shoulders as earrings.
Yes.
Because, we tend to, that bulk, and the shoulders should come down. And, and then the head comes back, and then you're in a proper position. And I hadn't heard that before. Yeah.
With anything you do, whether you're washing dishes, whether you're picking your kids up, whether you're lifting weights, you always want to be thinking about that. I always say, tuck your shoulder blades in your back pocket, right? So bring that chin back. Your ears should fall directly over your shoulders. Your shoulders should be back, and your head should be almost like, if you think about someone pulling a string straight up to the ceiling, that's the kind of alignment that you want to be having no matter what you're doing. And when you take a moment to center yourself and put yourself in that position, tighten up your core, and then do whatever you're going to do, you'll find that's probably one of the single biggest things toward prevention that you can possibly do.
Go ahead, Scott.
We've thank you. I was jumping in on the same thing. We find tension in the shoulders when people are doing karate classes. The other thing is their lower back won't be in alignment, so they'll stick their bum out, or like when they try to do like low stances and stuff, especially like horse stances, and I got to remind people to keep their hips underneath them, just because. You can just see the total structure of their spine is way out of alignment. And as soon as they start straightening up their back, everything changes. Their power changes, their speed changes. They look more relaxed, so they move a lot faster. The stand-up straight thing is definitely something. As far as moving, though, like when you're saying move, what kind of movements are you talking about? You're not talking about, like, I wouldn't think, like wakeboarding and...
Probably not. No.
Yeah.
No, I just mean, so for me, I call it puttering, just doing the stuff that I would normally do around the house. I mean, when you're in that kind of pain, it's exhausting, right? And you just want to sit down. So I would stay in the kitchen and, I'd bake muffins, or I'd cook dinner, I'd wash dishes, I would just do normal household stuff. So nothing that's taxing, but anything that would just keep me standing upright. And the whole time I was doing it, you just have to, right? Like having so much attention to how I'm moving and bracing my spine with my core and my abs, and just constantly moving until it wasn't time to move anymore.
Now, as far as pushing through, how far do you push through without hurting yourself? I mean, I know that's a tough one, but...
That's a really good question.
Because how many times have we said, come on, suck it up, Buttercup, let's get going?
And I guess that's where you have to find that balance between, you don't want to push too much so that your body can't heal, but at the same time, like I said, not giving into that urge to kind of lie down on the couch and just rest that way where you're unsupported. It's not going to help. One of the other things too that I always tell my patients, this is so important, is there are 3 exercises. They're called the McGill Three. They were created by Dr. Stu McGill of Waterloo University, and globally they are the gold standard of low back exercises to do to get yourself healing. I put a video in the Healthy Moms, Healthy Families Facebook page. So if you are a mom in Durham region, it's a private group. Just request to join the page, and the video is right there. It's also on my YouTube page where I've demonstrated the 3 exercises. But basically what you're doing is, when you feel like you want to go lie down on the floor and do these 3 exercises, because they are designed to strengthen your core, which is, it's like a back brace. It becomes like a girdle around your front, side, and back in order to help protect your back. And when I get patients, even when they're in the worst pain, just trying to do at least some of those exercises or some part of those exercises, they feel the pressure come off almost immediately. So that is a big, big strategy for making sure that they can heal. And, when you talk about pushing through, I think those kinds of things are good to push through, but you have to be able to listen to your body. And when it's saying, like, if things start getting more painful, stop.
When do I know I have to go to a chiropractor?
Right away. I really think if you have a spine, you should be getting checked by a chiropractor. Just like if you have teeth, you probably go to a dentist, and if you have eyes, you probably go and see an optometrist. Your spine, it is the framework of your body. So making sure that every joint is moving the way it was designed to is critical. And when you have low back pain, almost 100% of the time, there is one or more joints that have stopped moving properly, and the muscles are just contracting. They're spasming to protect an area that's gone unstable. And what chiropractors do is we find those joints that need to get moving, and we provide that intersegmental motion that the body is craving in order for you to heal. So yeah, for sure. I mean, getting checked by a chiropractor, first off. The other thing we do is we look at what are the positions that are causing you pain? What is the mechanism of injury? Because it's not the same for everybody. And then we can help you figure out how do you move in a more healthy way that avoids those motions, but will also create healing in that area.
Well, you've opened up the business to a lot of people. I'm thinking most have spines. So if someone is interested in talking to you, how can they get a hold of you?
Well, my office is in Port Perry. It's Elevate Women's Health Center. So my website is elevatewomenshealth.ca. You can find me on Facebook. My business page is Elevate Women's Health. You can find me on Instagram at Dr. Shawna Dingman, or you can just email me through the website, drshawna@elevatewomenshealth.ca.
Shawna, thank you for your time. And Scott, thank you for not jumping on that, because I have been accused of not having a spine in the past. So
when we talked about relieving lower back pain, all I thought was, I'm just going to get rid of Scott, because that's...
Not at all. Not at all. I look forward to it each and every week. Guys, thanks for joining us again this week.
Thanks for having us. It was great.
Take care. Bye-bye.
Bye.
That is Scott Campsall from Akami Kai Karate and Shawna Dingman from Elevate Women's Health in Port Perry.